Patrick will be talking about today. But if you're first time here, I think you're going to really enjoy what you see and what you hear here. I think we're going to playing around with the screens here. First of all, I want to just tell you about a little housekeeping and how to work the GoToWebinar control panel there. You can see that we've got some arrows up here. It's kind of pointing to some things. So if you want to open and close that panel right there, but more importantly, you can see here where we've got to type in your questions, that second arrow right down there. If you've got questions along the way that are pertinent towards the topic that we're on, we certainly want you to type those questions in. Patrick and I will stop. We'll review some of those questions as we go through them. Now, there are some questions that people ask that we'll probably say, like John or whoever it might be that's asking the questions, they just get back with your ABS rep. They'll be the ones to be able to help you answer those questions. But we want to talk about today, basic things about the business. Again, how much you can possibly make of being a medical billing company, and really kind of go over some of the other services that we have today also. Again, my name is Eric Auger. I'm the Director of Research and Development here at American Business Systems, and that gives us the luxury to be able to work with some local doctors here and stay in the loop and in the know and marketing techniques and all the nuances about medical billing. Certainly we get a lot of information from our licensees, but it's nice to have our little group here that is right, hands-on, right on the pulse of everything. So we certainly enjoy doing that. Before I go any further, though, you might see up in that little GoToWebinar control panel, there's a little icon of a hand. If you'll click on that, that will indicate to me that my voice is coming through loud and clear for everyone to hear. So Mary Pat, it's good to see you. Richard, it's good to have you here. George, it's good to have you here. Got some other folks that, if you don't mind clicking that hand, maybe if I can get Richard and Steve and Thomas and Lisa and Leonard and Joseph and Ernest, thank you, Crystal, Anthony, Corley. Great to have everyone here. There's some other people that are arriving, but thank you for doing that for me. And again, that helps me to make sure that my voice is coming through loud and clear over the webinar. First of all, I want to just introduce you, for those that are first time here, that who we are at American Business Systems. Sometimes you may have just gotten the invitation this last week, and you're just wondering, man, who is this group of people, and what do we do? Well, we're a company that has, for the last 20 years now, has helped put people into the business of medical billing, all sorts of people from all different backgrounds and walks of life, from folks that have been in construction to school teachers to airline pilots to people that have been in medical billing, all focused upon utilizing our web-based system. As you can see here, this web-based system can be used upon a PC or a Mac or an iPad or an iPhone or an Android type phone or device. We have multiple platforms which our system can be used from, and that you can actually do the billing, and the doctors themselves can log in themselves. If you have not had the time to go out to our website is absystems.com. Through here, you can learn more about us, learn a little bit more about who we are individually, learn a little bit about the company. You can go here where it says Business Package and learn about all the different services that we have here at American Business Systems. And if you want to really kind of find out, what it would take to replace your income, we've got some generic spreadsheets there that you can take a look at and then kind of go and calculate that out. But if you want a deeper understanding and you want to go a little bit deeper in your due diligence, click either one of these orange buttons, and that will get you into what's called our virtual brochure. And each of these sections have videos in them. They have information, as you can see here. If some of you might have been through the welcome page and you've seen some videos there, the rest of this is chalked out with videos and information based upon the business and how to build your business, how we help you get clients. Patrick and I may be able to talk a little bit more about that today. This week, you'll hear him. He is at training. He's not even in his office today. He's at the training class there at the hotel. So he may sound a little different today because he's on a little bit different device to talk with us today. But here is where we talk about training and then support, the technology, And when you're ready to make that step towards becoming a licensee, just click on it where it says Final Steps, and that has all the information about the purchase agreement and then how to become a licensee. We are part of one of the largest groups of independent medical billers, which is called Healthcare Billing and Management Association. We've been a part of that for the last few years back. Now, that's separate from the way we are here at American Business Systems, but this is just another great organization to be a part of, and we have been proudly be a part of HBNA for quite some time. A lot of people ask us about are we registered with the Better Business Bureau. We can certainly say that ABS has the highest rating possible with the Better Business Bureau here in Fort Worth, which is an A+ rating. So we want you to be able to go out there and find us out there online underneath the Better Business Bureau. We certainly encourage folks to come by and visit with us at any given time. You may be interested in coming and talking with Patrick, or maybe the salesperson, the rep that you're working with, to talk more about the business. You can certainly come by and visit with us here at our office here just north of Fort Worth in a little community called Keller, Texas at 5751 Kroger Drive. Just give us a call. We'd be happy to schedule a visit with you. Well, like I mentioned earlier, we are right in the middle of the training workshop right now, so our next one is about 6 weeks away. It is the last 4 days of February, the first day of March. Now, we do host our training workshops every 6 weeks. Some people have already asked me, hey, can I come to the training in March? Well, if it's the last or the first day of March, you certainly can. But this class will be one of those ones that kind of split the 2 months from February to March, and our next one will not be actually until April. So if you're looking to get into this business and you want to get started here in the first quarter of this year, you might want to plan on scheduling during this next training class here at the end of February. I mean, the time is going by so quickly, and I can't believe that we're halfway through January already. I want to introduce you to our founding person here, Patrick Phillips. He's the founder of American Business Systems and the CEO of the company. Patrick's written a few books here. Some of you have read his book on how to reprogram yourself for success. He's also co-authored a book called Wake Up, Live the Life You Love, and he's also authored another book called Cash Crunch to Cash Flow, which is more of a marketing tool for those that are brand new licensees to utilize and help you actually understand the business and use that for your marketing and give those books out to your doctors who are your potential clients. So again, I like to bring Patrick on right now, and I know that he's excited. I know he's been at training all day today, so he may even have a few things to say about training. So Patrick, it's good to have you here this afternoon.
Thanks, Eric. Yes, I'm here at the hotel, and I'm telling you, this gets more exciting as we go along because this class is basically just, some of them have already said that they've actually made contacts back at home with some people that they had been talking to before they came and said, look, you're not going to believe what I just saw. I can't wait to get back and talk to you about it. And of course, people back there are anxious for them to get back as well. So we do have licensees who've actually signed up clients before they leave the training week here. So
right.
It's pretty exciting. Well, we got a lot to cover, Eric, so I'm going to jump right in here with an article that was recently in the Healthcare Billing and Management Association magazine about where is our industry headed. Look at this quote. We estimate that the estimated growth in the medical billing industry at just under 6% per year. Healthcare is clearly one of the best sectors in a week. We misspell week.
That's okay. That's live TV here.
You can see we put these things together pretty fast. Anyway, in a weak economic environment. In fact, the chart that they had in there, I have to pull this right out of the article. Look at this: healthcare spending as a percentage of our gross domestic product from 1965. It was only looks like about 6% there, and by 2009 it was up to 18%. So there's no telling what it is now. We can't even keep up with it. But it is a huge industry. Look at this pie here. Out of the broad revenue cycle management and technology opportunity that's out there in America, the physician medical billing has about $9 billion. And about half of that is the office-based physician medical billing that we're talking about today. Folks, if you want to get into medical billing, doing medical billing for doctors, it's a $4.5 billion industry. That's a lot of money. You don't need a whole lot of that to be happy, I would think, huh?
Yeah, and explain to us why there's such an increase here of healthcare. What's triggering all that,
Well,
Patrick?
this couple right here will illustrate that. The baby boomers, the people who are retiring right now, there's over 10,000 of these people per day in the United States that are now moving into the healthcare system as retirees, which means they have more time on their hands, they have more health problems, and they're covered by Medicare. So they go to the doctor. So lots
Well,
of visits.
yeah, and actually, I was talking with someone today, and he even asked me. He says, "What about this Affordable Care Act?" And I was kind of explaining to him, not only do we have a big, you know, group of folks retiring and getting into Medicare, but we've got new growth there because people are getting health insurance. So there is going to be a lot of people involved in the healthcare
Yeah,
to get those
something
claims
like
done.
I think the number is like, I don't know, I've heard different numbers, but it's somewhere around 35 to 40 million uninsured Americans that will be in the system. That means that many more, visits to the doctor and that many more claims that need to be processed. Even the government itself here in this quote from the Bureau of Labor Statistics says that, this is a growth industry, but the actual on-site jobs, that is doctor who are hiring people inside their office, will be reduced because the billing would be outsourced. Well, that's exactly what we want to hear, right, Eric? I mean, that
Right.
we know that most doctors are either doing it themselves or they've already decided to outsource it, but more and more are outsourcing. So the real question is this: why would a doctor outsource their billing? Well, there's lots of reasons. Here's one of them. We put together annual costs for the physician billing. Look at that first column, folks. In-house cost to hire people to do the billing in the doctor's office with the payroll taxes, the insurance, the training costs, the leave coverage, and all the benefits and hardware and software and IT support. It's about $65,000 a year for a typical doctor. If they outsource that to you and you charge only 6%, some of our licensees get more than that. That's the going average out there. You're only going to charge them 28,800 based on the numbers you see here in this chart. Well, look at that. That's 48% less expensive to a doctor to outsource the billing. They shouldn't be doing it themselves anyway, should they, Eric?
No, and you know what we're finding out there, Patrick, is that doctors do know that outsourcing is their best way to go, and I know that we've touched on this in other previous webinars, but their biggest fear is not necessarily losing the money. I think we can actually show them where it's more of a benefit for them to outsource their billing. But again, they have that big fear of losing control, and if they keep it in the office, so they try to in their minds go, well, you know, I'll pay the extras to kind of keep that in house because I feel like I've got more control on it. But I think, Patrick, as we'll go through today, there'll be some things that we can share with everyone to say, look, not only are you going to be able to reduce what you can have to pay out, but also, my goodness, you're going to gain more control of your business than ever before.
Yeah, because with a web-based system, they can have access to the real-time data about their claims at any time. The big problem, of course, is that they've got all these rejections. The claims go into the insurance companies. The insurance companies want to find any reason they can, of course, to reject the claim because they get to keep the money, right? So
Right.
the doctors are fighting that. According to the American Academy of Professional Coders, it's around 34% rejection of those claims. And of course, that happens for a lot of different reasons. All kinds of errors can be made on a claim when it's done on paper or in a system that's not web based and in real time, huh?
Well, even if it is web-based, I mean, we're able to eliminate a lot of the areas that we've talked about here, also in other webinars about even if they type in their name in correctly. I mean, they can have a great web-based system too, Patrick, but if they don't know how to get that information in there properly, like our system can do, that will certainly make the rejection skyrocket with these other systems.
And if they don't have a clearinghouse that's actually integrated within the system itself so that they don't have to go and wait for a third party to take a look at those claims, that's the frustration that this poor office manager here is having, is because she has to deal with that on a regular basis.
Right.
And so it does cost more money for a doctor. According to the New England Journal of Medicine, 24 cents out of every dollar are wasted on administrative and billing expenses. Why would the doctor want to keep that in their in-house? That's 24% of their revenue, right? When they could pay, 6, 7, 8%. to an outsourced person who has been trained. Folks, when you come to our live training here in Dallas, you become an expert. Eric, I would estimate that most of our people, when they leave the training here, know no more than 95% of all the office managers that are out there. Wouldn't you?
I would agree. I think I mean, because so many people do come into the training going, and a lot of people that are on the call today, why would a doctor use me? And folks, by the time you get through with this training, it's not so much that you become an expert in doing billing. What you become an expert in is solving the doctor's problems.
That's right. And you can charge a whole lot less because you're working at home. This is all you do. You focus on doing the billing for doctors. You could have 5 doctors, you could have 100 doctors. We've got licensees that have over 300 doctors. So,
Right.
depending on how many people you want to hire to help you with that work. So the fact is that doctors know it costs them more than they would like to be paying. This doctor estimates that for every claim, including all the hidden fees that he has to pay for his people and the administrative and the computer system and so forth, that costs him about $20 per claim. Well, that's their profit. On some claims, that is
Right.
their profit. So when you can do it for you know say an average of $6 or $7 a claim to them, that's saving money. This is why doctors are actually leaving practices right now in droves because they're fed up with the expenses that are involved.
Right. And so what we are able to provide you as a potential licensee, medical billing company, we're able to provide you what most billing companies out there do not have, and that's in this full revenue cycle as Patrick has up here on the screen. So Patrick, talk a little bit about this because this was really what separates you as a medical billing company from other medical billing companies and how they can use that to actually gain more doctors.
Well, it boils down to this. Now, we go into detail, of course, in our training on what all of these things are that you see here on the screen, but every aspect of a doctor's practice has revenue involved in it. And so if you go out to a doctor and just approach a doctor like most medical billers will and say, I just opened a medical billing office. Do you need any? The doctors are going to say, no, fine. We have our billing under control. Thank you. Or they've already outsourced it to someone else. So, Eric, how is it that our licensees are signing up doctors, on a regular basis?
Well, it's because we do have, and again, I was talking to a gentleman today. We have these other services that we can introduce to the doctors. Our licensees can hold some different speaking engagements, even if it's with a small group, maybe 2 or 3 doctors at a time, talking about the Audit Guard or the Code Right or the Physician's Toolbox and iDocs now. I mean, there's just a myriad of different things here, and let alone all of that, most billing companies, Patrick, don't even have an EMR system. Our licensees, these new billing companies that join us here at American Business Systems, not only get a good billing platform like iClaim, you're going to get the EMR platform together. And Patrick, tell them why that is really important in today's world.
Well, because electronic medical records is what the government is requiring the doctors to move towards. And if they don't, they'll be penalized. They'll actually start losing money on their Medicare payments. Between now and a couple of years from now, the doctors can actually get back from the government up to $39,000. So we'll get into the EMR section here in just a little bit, folks, but just trust me when I say you can't just go out and talk to a doctor about billing. Sometimes they think that that's under control, but when you start talking to them about EMR, you have just opened up doors that you would not have opened otherwise because they're very aware that they need to get up to speed on electronic medical records, and most of them haven't at this point. So basically, we're going to teach you not just how to do medical billing. This is a paper form that doctors used to use when they were all, and believe it or not, there's still doctors out there who use these forms, Eric, the old 1500 form, they call it. But we're going to teach you how to do what you see here, very basic information, how to submit that to an insurance company and get paid through our web-based system, which we refer to as iClaim. Now, folks, this is the billing system that you'll have access to as an ABS licensee. It's a part of your licensing fee, of course, and it is web-based. Everything resides out in the cloud. We back up everything in 2 redundant servers in 2 different locations in the United States It's all HIPAA compliant, which means that the government rules and regulations for privacy is all followed step by step. And as Eric mentioned earlier, it's available on any device. All of the tablets that are out there and iPads and so forth and smartphones can access our system directly from those, as long as they have an internet connection, which nowadays, Eric, I just signed up my wife on her cell phone for $20 a month. She has an internet connection now, no matter where she's at, whether there's a Wi-Fi or not.
Right, and I tell you, the doctors are loving this because I think we've even talked about, Patrick, that what's driving and will continue to keep driving the EMR is the portable mobile access to the internet.
Yeah, no doubt. The doctors are using iPads and iPhones and Android phones in their personal life. They want to use them in their practice as well, and we're bringing that to them because, as you know, iClaim was designed for the iPad, not just
Right.
adjusted for it. It was originally designed to work on the iPad just beautifully, as you illustrated just the other day to the class here, Eric, via our go-to meeting that we did with them. Okay, so let's figure out how much money people could make just with the medical billing side of our business. Now, folks, out on the website, as Eric told you earlier, I'm circling it here. I don't know if y'all can see my cursor, but this is where we went to get here under income potential. How much do medical billers make? You can fill in the numbers that you want here on your own, but I have filled in what we think of as our typical licensee. Now, remember, I told you we have licensees with over 300 doctors. Many of them have dozens of doctors, but when I say the typical licensee, we're talking about being able to make a decent full-time income replacing your current income that your job produces. You would need anywhere from 3 to 5 doctors. So I've used the average of 4 here, each seeing about 20 patients a day, 5 days a week. Now, if you're charging just the 6% that we talked about being the average nationwide on average claim of $100, look how much money you can make. I'm going to click the submit button here. And as it goes to the next screen, you see that it says it right here. Can you see that little number right there? That's right. That's $124,800 in annual revenue from just doing medical billing. Now, folks, admittedly, this is where the money is in our business. We have other services. I'm going to show you how you can make money from all of those, and that will add up substantially here and basically double this figure at the end of the webinar. But it's good to know that just from 4 doctors, folks, is all you need to make what we think of as an executive income, a 6-figure income.
Right. Hey, Patrick, there are some people that are writing in some questions, and we want to encourage other people to type in their questions. So if you want to, for some of you that are on the call today, if you got questions up to this point, we would certainly like to be able to help you with that. I'd like to address this one from Steve that he's got up here right now. Apparently he's calling on doctors and has been calling on doctors already. And so, Patrick, he's asking the question. He says, I know how incredibly painful it can be to move a physician over from an EMR system, from one EMR system to another. He said he's a sales rep. How is this system different, and how easily can we make a doctor move from one EMR system to another?
Well, you're right, Steve. It is incredibly painful for doctors who are all based on the system that they're using now to move to an electronic medical record system, because all their paper then moves basically to the cloud. It's out there at least electronically so they can access it. And to them, that's a huge step. It is a major disruption to most offices. One of the things we do, of course, is a little different, and that is Eric, you, of course, have done these demos, so I'm touching on something that you probably know more about. But basically, we actually help our licensees by doing a live over-the-web demo of the system to show the doctor the simplicity of it. Now, that doesn't mean that they're not going to spend some time, but remember, that's why the government is giving an incentive of up to $39,000 to cover the time that they and their staff will take to move over to it. Steve, you didn't indicate what you were selling to doctors, but unless it's an EMR system, believe me, you would have to see our live demo to understand how powerful it is.
Yeah, I think he's a pharmaceutical rep, and so here's how we like to approach it, Steve. And I'm glad you brought yourself up here because you're in sales and you understand some of the things that doctors go through and getting them to and that they've been probably bombarded by other EMR software vendors. Well, Patrick, you know, and we certainly wanted to address that today, is that we don't want any of our licensees to become a quote unquote sales rep vendor for an EMR system.
That's
That's
right.
why when you let us handle that on our end, because what we're going to do is tie in your business as a medical billing company with the platform. There's no other company that does what we do, like Patrick was saying. We tie in the system, as Patrick is showing you here, that it is a certified meaningful use platform, but it is to increase the doctor's cash flow. So you mentioned how incredibly painful it might be. We cannot make it painful because we are literally going to help the doctor increase his or her cash flow. So it makes it not so painful moving them from one system to another.
That's right. And it can be done in steps. It's a very slow process. If a doctor wants to go very slow and start by just doing e-prescriptions, for example, we can teach them how to do that using our EMR and then lead them into all of the neat things that it can do for them as they have face-to-face encounters with the patients. Lots of advantages, of course, to talking to a doctor about the electronic medical record side, because it's a great door opener for your billing services. Like Eric said, the demos are specifically showing the doctor how that your services as a medical biller can help the doctor, and since it's completely integrated with an electronic medical record system, ease them into it painlessly. Well, with as little pain as possible.
It's a little pain as possible. And Patrick, that's what really separates not only American business systems, and I know that we want to get through some of these other slides today, but you know, again, folks come on here because they want to know what makes us different, what's going to make them different. And Patrick, we know, and we're already starting to see the success. And I mean, it's incredible to even see the light bulbs even come on even further with even the folks that are in training today, of understanding that, you know, we are literally separating ourselves from all medical billing platforms, all EMR platforms, all competitors out there by our medical billing licensees out there working with us, gaining more business. It is unbelievable what's happening right now.
Yeah, one of the things we teach them, Steve, here in the training class is to do what's called a practice analysis with the doctor's office to gather some information to find out, you know, where the pain is in the office from a revenue standpoint. Well, what we've learned is that by setting up, just Jim, telling the doctor, look, I have technology that can increase your revenue by up to 30%. Are you interested in seeing it? Take 30 minutes and look at it. By setting up those demos and letting us do the demos, not you. You don't do anything but attend them just like you are right now, listening to what's being said. We do them and we tie them in with the medical billing in such a way that the doctor says, yes, I want to outsource my billing and get the advantages of the EMR. We answer all their questions for them. At the end of the demo, sometimes all we hear is just, hey, what do I do next? What's my next step? How do I get started? And of course,
Right.
That's all you're looking for marketing any service out there, right?
Absolutely. And Patrick, didn't you get an email from a licensee today
I spoke
saying
with
that very thing?
Yeah, no, I spoke with Terrence on the phone, and he said that this opened it up for him completely to have that demo. They were blown away by it and said, "Send us the paperwork. How quickly can we get started?" Yeah.
Right. All right. We kind of took a little diversion there, but since we're talking about the EMR, let's talk about what kind of money can be made on that.
Yeah, now, folks, we'll go into detail, of course, in our training, and you can ask your ABS rep a little bit more about this, and there's more out there on our virtual brochure. But in general, on average, you can earn about $100 per doctor per month just for getting them involved in the EMR. Now, this doesn't have anything to do with the income you just saw from doing the billing. You're going to make that. This is in addition to that. Excuse me. So, assuming that you're making $100 a month there on our system by just allowing the doctor basically to have access to it, you'd be making about $1,200 a year. If you had 4 doctors, that would be, drum roll please, $4,800 additional revenue. And folks, This is what we call mailbox money. This money is sent to you just for the doctor actually utilizing the system. They're paying a fee to access the EMR each month, and you are getting paid a commission, so to speak, out of that. But you don't really do anything for it, do they, Eric?
No, I mean that's part of the nice thing about the EMR, and again, it helps you as a medical billing company literally do your billing. So not only are you making money, it's making your job much easier.
Yeah, saving you a lot of time on the back end. Now, this is not a whole lot of money here, folks, I know, but add that to the 124,000 that we just saw earlier, and it's better than a poke in the eye with a sharp stick. All right.
That's a good way to put it.
Okay, so let's talk about this other service that we have coming up here. I'm going to preface that by giving you this quote here from the McKinsey company. They say physicians typically collect only about 50% of their outstanding patient balances. Eric, I can hardly believe that. Can you? 50% of the money that patients owe them, they don't collect but a half of that.
No, and you know what? It's amazing that you put that up there, because I was literally talking with a doctor today that right now he has well over $100,000 in receivables over 150 days.
Oh my goodness. Well, we can
Yep.
collect our average on that, by the way, is about we collect about 41% of that money for doctors. So that's like found money for that doctor. Otherwise, he just has to write that off at the end of the year, doesn't
That's correct. I mean, in most doctors, I mean, Patrick, I don't know about you, but we're both in business. We're both businessmen. We don't like to lose, but my goodness, can you imagine losing a fourth of what you could be earning every month? I mean, every year.
Yeah, and as you can see there from the bullets I put up on this service called Choice Pay, folks, this is a service you offer to the doctor. As you can see, it helps give the patients a choice of how to pay out their bill and so forth, and it automatically deducts it from their checking account or credit card. Uh, it has increased doctors' collection from the patients up to 98%. So we went from 50% to 98%, folks. That again is astounding. Doctors are just amazed that we can do that with this one service alone. And look at this, you make money from this service, of course. Again, going back to our example of four doctors. If you had four doctors, each with 200 patients, the average payment that people decide to pay is around $40 a month, some more, of course, some less. Anyway, you make 5% of each one of those payments. That's $2 on each one. Doesn't sound like a lot, but look, on 800 patients, that's $1,600 a month, or an additional $19,200 a year. Again, nothing to sneeze at, and we've got licensees who have focused on this service and gone out and gotten dozens of clients, not just four.
Right. Yeah, and I'm glad you brought that up, Patrick, because all the services that we're showing everyone today, it's not that you have to use every single one of them. They're there
No.
for you to get you into the door, talk to the doctor, because again, Patrick, we know from like what you said earlier, if anybody just goes up to a doctor's office and say, "Hey, do you need medical billing?" They're going to turn you down. But if we go in there and say, "Hey, I can help you collect on money that you're not collecting right now," and it's not going to cost you a lot, now we're dealing with the doctor on a completely different level.
Well, yeah, and then so moving to this next, this is a little different. This is the money that we can help collect for doctors from the patients that have not paid their bills. That 50% that we're talking about out there. So the previous service, Choice Pay, of course, gets current patients on a system. The old debt that's laying out there, and believe me, there's some doctors that have up to a $500,000 in their bad debt drawer. We can collect that totally automated. It's not a collection agency, folks. You're not on the phone calling anybody. This is totally automated, and it collects, like I said earlier, an average of about 41% of all the outstanding revenue that's out there. Costs the doctor as little as 5%. That's unheard of. Most a collection agency will cost them 50%. And you make a residual income from each one of those patients' accounts. Like I said, this is not you getting on the phone and calling little Mrs. Jones and saying, where's your payment to Dr. Smith? This is called Quick Collect, and it's totally automated online system. So back to our four practices. Let's say that you had four practices now with three doctors each, with 24 of these accounts per month that are turned over to us for collection. The average past due we found out there is around $600 per patient. If we're collecting 41% of that, and you're making a commission on that, you would earn about $1,995 a month residual income. And Eric, this is again my famous mailbox money. Don't you love that term? You go to your mailbox, you get the check. That's what you do for it each month. So we've lost Eric completely. I don't know where he went, but we'll wait till he gets back on here. He may have dropped off somehow on his computer. Okay, so there's another $23,940 from Quick Collect. So guys, I hope you're keeping track of all these numbers, because at the end, I'm going to give you a quiz on this and see how much money you could make if you were offering all of these services. Now, okay, so moving on from the previous service that we made some money on, let's talk about this one. This is a big problem for some new doctors especially, and that is there's nobody there or they don't have enough patients. One of the services you can offer, folks, is called Auto Guard. It allows you to help build the doctor's practice through the use of our online automated card sending system. Now, these are not e-cards. These are real full-color greeting cards that are printed and mailed and stamped and delivered by the United States Postal Service. Old school stuff, huh? It keeps the doctor's practice at the top of the patient's mind, and it's great for reminders and referrals for the doctor. By the way, on a side note, the licensees can use this to build their own business, can't they, Eric?
Absolutely. I mean, this is a great service to be able to help build your own business here.
Yeah, everybody loves greeting cards. We have an online system that has over 15,000 different cards, some of them designed specifically for the doctor's practice. And you can go in and personalize these, even adding the doctor's signature to these cards. It's called Auto Guard. Find out more about it, of course, in our training class. But again, how could you make money with this? Well, it's real simple. With those 4 practices and 3 doctors that we mentioned earlier, each with about 200 patients on Auto Guard, your profit is about 96 cents per card. So that times the 2,400 cards that would be going out each month for those 4 doctors, those 12 doctors in 4 practices, would be making you about $2,300, or about another additional $27,640 a year. So folks, if you wanted to focus just on this one service alone, there are people making a living from this service alone. There's that much money to be made in it. You could just add that to the other figures that we've shown you already. Again, if you're offering all the services, you could be adding those numbers together. Remember, they're all optional, like Eric said earlier. Okay, another big problem we have out there. This one, the guy today that called us and told us he had just signed up an OBGYN, he said, Patrick, I had to make my way through the office, through the boxes that were in the hallways of patient records. This doctor needs this service. We call it iDocs Now. Folks, this is huge because it's the new future. It takes all the digital existing records in the doctor's office, and you can then send them all up to the cloud in a web-based system that gives the doctor and his staff access to those documents 24/7. It's HIPAA compliant, of course, which means it's protecting the privacy of the patient's data, and it saves the doctor time and money. It's like, think of it as a file cabinet just up there in the cloud, so that the doctor sends all their documents to and can access them anytime they wish. They get them there by just scanning them into a small scanner that you can provide to the doctor, and once they're up there, the doctor and his staff can all view those documents and search for those documents any way they want. It is a fantastic system that you, as an ABS licensee, can actually use, by the way, to run your practice as well. So let's see how much money you can make on that. If you had 4 doctors with 4 practices with 3 doctors in it, and you earned about $140 per doctor per month, well, that's 12 clients times 140. That's $1,680 per month, or an additional $20,160 on this one service alone. Now, folks, when we tell you that we have licensees who have sold dozens of clients, not just 4 practices, but dozens of practices, you can imagine what kind of income they're making from these kinds of services. Again, we're just trying to give you a better feel that medical billing may be more lucrative than you thought it was. Eric? Boy,
I'm still here. I'm making sure that we're still doing well here, but I believe you're, again, for folks to understand that, like Patrick says, that, some of this money is what's called mailbox money, but more importantly, a lot of these services that we're talking about here are those services that will help separate you from your competition out there.
That's
because
right.
no one else is doing these types of things. So you might put a few $100s in your pocket every month, ever so often, but more importantly, what you're doing, you're gaining the trust and the wherewithal to be able to get what Patrick mentioned earlier was the billing portion of it, which there is where you make the bulk of your money there.
Sure. Yeah, these again can just get you in the door sometimes when you start talking to a doctor about these things to lead to the medical billing. Now, Eric, why don't you talk to them just a second before we introduce this next service they can make money on? Talk to them about a super bill and codes.
Yeah, absolutely. We get this question asked by a lot of folks. And matter of fact, I believe Zia asked the question, how much prior knowledge of medical billing do I need to have before getting in this business? Well, what you need to know that, as we're seeing here on screen, that a doctor has what's called a super bill or an encounter form. And what this is that the doctor is circling these codes. These codes are on a piece of paper that are his normal fees or his normal codes that he goes through all the time, which is going to be like, the codes for the procedures and the diagnosis codes. And so the doctor is going to hand this over to you, and then at that point, then you'll be able to certainly just be able to plug those numbers directly into the system. So this is really what Patrick is showing on the screen is what's called either a super bill or an encounter form. Those codes come to you, and you're going to take those codes and literally put those in an iClaim, therefore processing a claim.
And we just showed you one of the ways that you could get this information from the doctor. It's the iDocs Now system that you would have access to their account to be able to go in and pull the documents up on your screen once they have scanned them into you. But Eric, they don't really need to know anything about coding to be able to do this because the codes are all in our system, aren't they?
That is correct. Absolutely. All these codes are already in our system.
So if you type in a code and maybe you can't read it or you accidentally type a wrong number, it would come up and tell you that because it wouldn't match the the procedure or diagnosis that the doctor had circled there on that form. So we're telling you that because those codes can lead to problems for doctors. Every once in a while, Medicare can come in and audit the doctor to make sure that they're putting in the right codes. That is, they're not over-coding and charging too much. Because if they do, they can get fined, can't they, Eric? Isn't it like, I don't know, several $1,000s per error that Medicare fines?
That's correct.
If they do an audit. So Audit Guard is something that you can offer to the doctor that our certified medical coders that we have on our staff can go in and look at the doctor's current codes and generate what's called an evaluation audit that basically comes back and shows the doctor, here's where you're miscoding, undercoding, and in some cases overcoding, and it can do a lot for the doctor to give them that assurance that they're not going to get fined by Medicare. This service alone, folks, can make you a lot of money because there's a big upfront fee involved in it. If you set up a doctor on this with 4 practices and 50 charts are reviewed per doctor, you could earn about $800 per doctor. So one of these per week would make some people a full-time revenue income. Each doctor has about 4 reviews per year, so that means that 12 doctors times 4 reviews would be 48 reviews that you do for these practices we mentioned earlier. That's 800 times 48, or an additional $34,800 a year on Audit Guard, one of our many services that you can offer. Boy, this just keeps mounting up. I think I'm going to want to get into this business by the year.
Well, it is. It is good income, and it's good, and we just want to stress to you as a potential licensee is that, again, these are the things that we're talking about. What Patrick and I are talking about, all that we're showing you, you can make money on these things. These are the things that separate you from your competition out there as a medical billing company.
Yeah, that's important because, folks, there are other medical billers out there, as you probably know, and what is it that's going to make you stand out in the marketplace? Well, one of the things is what we're showing you here, that having these other services, the doctors are going to want to talk to you about some of these services, and we have licensees that go out and offer that Audit Guard, for example. That's a great door opener. They make money on it, but it gets them in the door. And once you've offered one service that's helped the doctor, now you come back in, you see, and you're their friend. Your company name is at the top of their mind when they do decide that they want to outsource. Now, this is another super bill, and again, they're all a little different from each doctor, but as you can see, they all have numbers, codes that they use. The reason I'm showing that again, because we have another service that you can offer that will actually help you with doctors who are, look at this quote, we work with hundreds of physicians and practices each year, and probably 80% of all the doctors with whom we work under code, not over code, under code. And so if that's the case, what does that mean? It means they're not charging to Medicare or the insurance companies what they could be. That's why Mike Inger with a VIA code says the average physician could increase their monthly billing by about 30% if their medical coding was done accurately. Therefore, you have another service that you can doctor. It's called CodeWrite. CodeWrite allows the doctor to go. Am I still on the air?
You are. We almost lost you again there, but yeah.
All right. Well,
go ahead.
That makes me wonder because I have a different slide on my. I'm seeing here on my iPad. Are you seeing the CodeWrite flyer?
I am seeing the CodeWrite.
Okay. All right, my iPad battery died, I guess. Okay, so CodeWrite. Wow, this is an interesting webinar, isn't it? CodeWrite will allow you to give those codes that the doctor's currently using to us. Our certified medical coders looks at those and sometimes can improve the reimbursement rates by up to 30%. They give them real-time reports for the doctor. Here's a picture of some of the real-time reports coming up here in just a second. Like I said, all those codes are built into our system, and the reports allow the doctor to see with their own eyes exactly where their coding needs to be and get them, like I said, sometimes up to 30% more. So how do you make money? Well, again, back to our same example there of 4 practices with 3 doctors. The codes reviewed on 400 claims per month will earn you about 50 cents per code. In 1 year's time, that comes out to about $2,400 a month. And so you could be earning that with those 12 doctors annually, somewhere close to $30,000, $28,800 on that one service alone. Okay, well, Eric, we finally got through all the services. We've got about 4 minutes here, and I think let's take this a little bit longer, even though I'll stop the recording here pretty quick. But we want to answer some questions. So let me just get to this slide to show you folks that if you did offer all the services to the doctors that we just showed you, of course, you could make, like I said, about $284,000 a year. So this medical billing could be much, much larger than you think it is. It could make you a lot more money. Of course, we have people making this kind of money that are just doing medical billing as well.
Right. All right. Well, let's take it through, and you can kind of just while we're going through some of these questions here, Patrick, you can kind of maybe step through some of those other slides as we're going through that. Yeah. Johnny asked the question: do I need to install a software in our desktop/Mac in the doctor's computers? And Patrick, you want to talk about that because that has to do with web-based versus server-based system.
Yes, we get that question a lot because there are other companies out there, of course, that offer software that is what we call server-based. In other words, you have to install it on your computer in your office. Then they have another module that you install on the doctor's computer, which is very dangerous to do that anyway, mess with the doctor's computer. Then you have a third piece of software that you connect the two together to be able to make them talk to each other. Folks, ours, there is nothing that installs on your computer or the doctor's computer. This is web-based. You literally go to, in your browser, in Internet Explorer or Safari or whatever you're using, go directly to our website, log in with your ID and password, and boom, you are in the system. In fact, Eric, you were in the system a while ago live while we were having that problem, weren't you?
Correct. Yep, and whether I was on a Mac or a PC or on an iPad or anything else, I could have shown a doctor that in a heartbeat, and that's the nice thing, because Patrick, we have doctors that want to see what's going on with their claims, and maybe even their wives want to see it. And so as long as we can give them internet access, or they have internet access, we can literally have the doctor see what's going on with their, and that helps reduce the fear of a doctor saying, if I let an outsourced billing company do my billing, how would I know that they're doing it correctly? And with our web-based system, unlike server-based systems, that gives that doctor another level of trust with you, that they know that they can log in anytime and see what's really going on with their claims.
That's right. And guys, talking about real life examples here, let me just say this. I had some here I'm going to show you, but I'm going to ask you to do this. Ask your ABS rep to give you some more information about these. You'll learn about Scott Harris, for example, who just signed up a podiatric clinic with 3 locations. They'll be doing several hundred claims per month. Tierney Martins, who one of our licensees just signed up a 24 doctor group. So the kinds of incomes we talked about today, folks, can be dwarfed by some of the licensees that are out there really doing this. Adam Nager and his partner Adam Smith just signed up a doctors group of 120 doctors up in Pennsylvania. Benjamin Ishkahoff and his partner Ari have over 300 doctors. So folks, the numbers that I showed you today, of course, are certainly not typical. It's kind of like those weight loss ads, you know, not everybody loses 400 pounds. Well, in our case, not everybody makes $284,000, but folks, isn't all you want is the opportunity to make any amount of money you want to put in the effort to earn? And that's what we give people. Okay, Eric, as you ask another question or two there, I'm going to throw up our next webinar. Yeah, we already know what it's going to be. And it's coming up next week. And you folks can actually, am I still on the air?
Yes, you are. Go ahead.
Okay, well, this is basically the next topic, and you guys can go out and register for it. Right now, we have the new link right there at absystems.com/webinars, and it's why would doctors outsource their billing to you? So we're going to specifically hit that head on as to why doctors, you know, the advantages of outsourcing versus doing it in-house.
Well, Patrick, I think we pretty much answered most of the questions that did come in. I tried to field as many of those while you were trying to get some things up going again, but we did get those taken care of. So I know you want to try to get back to the class there. Do you have the? Yep, I wanted to make sure that you got that next workshop coming up there. So again, folks, if you're looking to get into this business and you're wanting to know about when our next training workshop is, it is February the 25th through March the 1st. That is the last 4 days of February and the first day of March. March the 1st is a Friday of that particular week. So if you're looking to get into this and you want to start making your plans, 6 weeks out is a very good time, especially if you're having to fly in. You want to check airline flights and get those within that 14-day window before February the 25th. So if you're planning on coming, you got to be kind of thinking that I want to make sure my airline flights are booked right around February the 14th. So, so if you kind of think about it, that's about 4 weeks away. So, be looking at that so you make sure that you get the best rates on your flights there. Give us a call here at 866-565-8413. Talk to any of us. Patrick's got up here on the screen about our 100% money-back guarantee. And Patrick says that if you come to class and you just find out that this business is just not right for you, then you are more than welcome to ask for your money back, because we want to make sure that you've seen everything that you need to see, but always have that option. There's no other company that does what we're doing here. And again, that kind of goes to another question that someone asked earlier: what separates us from other competition? And this is one of those areas where we do want to have a 100% money-back guarantee. And we actually have that in our contract. So please ask for our purchase agreement. You can review that, and we'd love to show that to you and explain that to you in a little bit more detail. So give us a call here at 866-565-8413, and we look forward to talking with you and hopefully seeing you at one of the upcoming trainings. Thanks, Patrick, for being on here with us today.
You bet. Thanks for hosting it today, Eric. Bye for now.
Bye-bye, y'all.